one of the challenges we face in India, and I'm going to put it out there, is staff is hard to come by, and I don't think dentists in India, they have given it a thought, but they haven't spent enough effort in building that kind of an organization, right? It is beyond them. So, what are your key experiences in building up staff and getting them together and getting them all charged up with this vision of giving
So first
20%
and
more?
foremost, I'm sorry, like 1 billion people and you're complaining about staffing issues. That's just not fair. That is so not cool.
See, the thing is, when it comes to the quantity, I'm sure that we can match any country apart from China. But what I'm talking about, the right kind of people, you want to, you have to build them up. So, what is it? How much of this is an investment from your side? Because ready-made people, you can't get them. So, even if you get good, technically good people, you still have to motivate them.
Okay, so we are blending this, Vikram. We are going off my script, my hard work script. Okay. I would say that we have a very common saying, at least in the circles here. I've learned a lot from my colleagues here, so I have to give them credit too. We don't hire for what they know. We try to hire for who they are. And it has to do with, again, the real things in life are old cliches. You're hiring and you are going to hire for integrity. You're going to hire for the attitude towards work for people, and you don't discover that immediately. We usually don't look at resumes a lot. I have had very experienced staff members, brilliant clinically, who I had to let go because it was not working out. They lack something very key, possibly to our practice. No two staff members bring the same thing to the table. That's one thing you recognize. The common baseline that I feel, like I said, is integrity towards work. And I don't like grumpy people. I have handed my card at restaurants to servers who were charming, who were alert, who were interested. If you talk to my lab guys, they like to hire musicians because musicians have to read and play at the same time. And with lab, you have to have this kind of, fabricating appliances, you have to have similar motor skills. I learned this from my lab people. So you're constantly looking for something more than what's said on paper. And then we have a process where you are hired on a temporary basis. And during that period, it's a courtship of sorts, and anybody can leave. There is no hard feelings. And, you can have a month. I think in a month if someone's going to work. You can have 3 months, and you're going to know if someone's going to work or not. After that point, once they're in, they have to have their skin in the game.
Okay.
And there are a variety of ways to do that. I will say one thing for sure. If you want to go for it alone, it's boring and lonely. It's like being an alcoholic drinking a bottle of wine by yourself. And I do not ever want that for me personally. So when it comes to my team, my bottle of champagne means more to me with them, which means that as we are working day to day, their needs are met, their voices are heard. After they have covered a certain number of years in my practice, they have more skin in the game. Skin in the game can also mean if the practice is doing well, and you can set your own parameters. You can decide if you want to see money or patients or whatever have you. Set up your own goals. They have a role in you meeting those goals. So pay them. Pay them. Be human. Give them the time off they need. If they can do 8 hours work in 6 hours, send them home. Don't keep them there. And thanks to my mom, I think throughout school, the idea was how to create more time for play, so do focused work. I think that's still a motivating factor for me. And other than that, here, I mean, I don't know how it is in India now. I've been away so long. So retirement, healthcare, those are the things we offer. We offer paid leave. You have to give them paid sick time off. That's the law. All of those things, and there's a certain level of flexibility. The other thing I would say is behavior. I've had people who left our practice because they thought some place would be a little bit better. I will say this, that we have had most people who left return. Or I still have people who want to return. And one of the key things, besides, there's money and there's benefits and all of that, the other thing is behavior. Are you going to walk in and wish your staff? Are you going to be polite? If something goes wrong, are you going to address it in a certain way? Are you a screamer? I swear to you, I know dentists who are going to scream at their staff. I know that existed in India. I don't know about now. So that's one aspect. I could talk about this for 2 days. There are so many minor things that go into it. It's They have to have a shared sense of purpose, and that shared sense of purpose does not have to be in your big vision of, I want 5 practices, but they need to, like, I will tell my staff this, that there's these patients who go out. We could not do this work without them. It's true, we couldn't. So they are extremely, extremely important to me in that sense. And the other thing we encourage is reviews. We ask them, ask the patient for a review. And many times it's great that patients name the staff members.
Mm-hmm.
So they are asking for part of this. There are many, many things. Like I said, I could go on and on. It's not a small animal, it's a large animal. So when you talk about team with many little animals and the large animal. So yeah, I love my team. I say this, that life is sweeter because of them. Life has more drama because of them. I have more stories to tell because of them.